Hey, Roger Martin here from Billings, Montana. This is Dick Moore's TV. He's one of the people I subscribe to. But the question is, who's really telling the truth on Obamacare? Individuals are required by law to get insurance coverage by the age of 65, or that's what they're telling us with Social Security benefits. And they're threatening us and saying that we will be fined for the first 3 years and will increase in the fines over the 3 years. So who is telling the truth on Obamacare, and what can legally be done and lawfully be done to either avoid it or use another system or move it in a way where government does not mandate the insurance requirements and premiums and policies uh, of the state or the federal government?
A U.S. District Court has just found Obamacare unconstitutional, reversing the ruling of the Roberts Supreme Court. How can a local court reverse the Supreme Court? Well, the situation changed when the Republicans repealed the mandatory requirement that you have to have health insurance and the fine that was imposed on people for failing to have health insurance. They killed the main tax in the legislation.
Again, my question is, what can the government get involved in and what can't they get involved in? This is healthcare has been a private, commercialized entity as long as we've had healthcare in the United States. Now the government is getting involved in it. And the question is whether or not that is constitutionally legal. In my mind, I say it isn't, but the government says it is. The movement towards the federal government to the state is a movement in the right direction, but the movement that the government controls this form of legislation, this form of commerce, that's the question I have.
And the Roberts Court held that the law was constitutional, not because of the Interstate Commerce Clause. It failed that test, but because it was a tax, and that Congress had a limitless power to tax.
Now, I disagree with the idea that Congress has a limitless power to tax. The founding fathers said that the representation of the citizens in the states have power over that ability to tax, that Congress doesn't have a limitless ability to tax. I disagree with that. And I think the citizens need to understand that that is not a constitutional right by the Congress, and that the citizens have to have representation in their taxation. If there's no representation in our taxation, then it doesn't matter what Congress does. And that's the fly in the ointment in my mind.
But now that the tax has been repealed, it's no longer a tax, and the court ruled it is no longer constitutional. Interstate commerce cannot be defined as forcing people to buy health insurance if they don't want to. So this undermines and takes away the whole basis, legal basis of Obamacare, and the court has just struck it down. This is a magnificent opportunity for the Republicans, with some Democratic help in the House, to paint their version of health care, with separate funding for those with pre-existing conditions so that they can be covered, completely loosening the requirement that every health insurance policy has to cover all of the various ailments known to man so that premiums go completely crazy, and eliminating the requirement that people buy health insurance and giving them complete freedom of choice.
We'll see about that. Government's getting into it one way or another, and it doesn't seem like that is going to disappear anytime soon. My question is, why is the government into health insurance and regulation of health insurance? It is Roger Martin from Billings, Montana. Good day.